Welcome to Ask Your Pharmacist Corner. Please subscribe to my channel and give comments. As you know, this program is every week, once a week, and I want to continue this. So please ask your questions so I can answer it in these sessions. This week is about COVID-19. Is it a second wave or continuation of the first wave? The true COVID-19 is a global pandemic. About 11 million of people worldwide have the virus, and about more than 500,000 have lost their lives. So we have about over 500,000 deaths, and about 11 million people have got it. And in the United States, I think it's more than 3 million people have got the virus. We're gonna go through some of the this infection stages, what to do with it, what are the symptoms, and what to do to prevent it, and what is available in the market now to as far as the medications go. The infection of COVID-19 can happen through respiratory droplets. For example, the spits, runny nose, if somebody has it. And some people say through body fluid. It's possible that you can get it through air. And I believe in that. Actually, I think air around the person that has the virus or is asymptomatic and has the virus can cause, can pass it to somebody else to cause the infection, the coronavirus infection. This is a very important virus that we still don't know what are the symptoms and the full action of this virus. So the symptoms that can happen. Also, before I forget, even by touching the surface, you can get it. The symptoms are, as they say, fever, chills, cough, or in fact shortness of breath. But the unexpected symptoms are more than what is seen. So fever and cough, or the shortness of breath, not everybody gets that, and not everybody has that. This virus has so many symptoms that because it can go to every organ of the body because of the receptors that the organs can have in common. It can be in your nose, causing congestion, or it can go to your throat, causing sore throat, cough, in your eyes, causing infection. In your intestines, it can cause diarrhea, also body pain. The nerves, the neural system of our body, our brain, it can be affected by it, causing headache, dizziness, lightheadedness, nerve inflammation, even body inflammation. So this virus can occupy your entire body. Now, the incubation period for this virus is anywhere between 4 to 14 days. Most people have it, if they get the COVID, it goes within 14 days. But a lot of other people have this virus in them for more than 14 days. So they can have the symptoms for 28 days, 30 days, even 6 weeks. But it doesn't really go away. So it doesn't mean that if you are symptom free and don't have a virus, your body builds up immune system to it, but the immunity is not forever, so it can come back even in people who already have it. My advice is for the young people who have or who are asymptomatic. They have to be very careful when they go around or elderly, or if they have the symptoms. The elderly, the immunosuppressed, people who have cardiac issues, diseases like heart problems, diabetes, hypertension. So if you're around those people, we have to be very careful. This virus, in fact, can also affect your appetite. So, and what is very common is the loss of taste and appetite and smell. So you have to be very careful with this. The best thing to do to prevent this is wear a mask. It's very important. If you go outside, wear a mask. If you're in a group of people that you don't know, or more than a few, wear a mask. Wash your hands every time. If you're working and if you touch a surface, like the sanitizer are really good and they help very much. But sanitizers can also affect your skin, and the skin can be bothered. So you can get dermatitis, or you can get itching of the skin or eczema of the skin. So sanitizers are good, but they're they have high level of alcohol, so like 70% to 90%. So that's why you get dry hands. So you have to be very careful with sanitizer, but you can wash your hand. That is no problem. And wash where you go. If you're going in a group of people, out with a group of people, make sure you wear your mask. If you're doing gatherings with family, make sure it's mostly outside and not less of inside, because if you're outside, it's harder to pass the infection. As far as the drugs that are out for this virus, there's a new one out that has been working very good. It's 32% effective. The name of the medication is actually called remdesivir. So this is something that is a medication that helps the patients that get it. This coronavirus. There is another medication that is being used a lot right now, but it's to reduce the inflammation of the body, and it's a steroid, and the steroid name is dexamethasone. So because it actually reduces the inflammation in your body and the swelling in your body. So it helps with the symptoms, but it does not help with the disease itself. They asked me to talk about, is this a second wave? Is the second wave is coming right now? And I have to say that I believe is still the first wave. So our curve goes up with the disease in the country, in USA, but it never came back really down. So it's somewhere, it stopped somewhere in the or actually it did not stop, but it kind of became level at top. But then once we opened the businesses and works, and people went back to the parks and the beaches and all of that, and then it started going back up again. So it never came down. So because of that, I think it's still continuation of the first wave. I hope the second wave never comes. I hope that the vaccines that they're working on, when it comes out in January, for first thing is safe, and second is effective. So safe and effective. In January, the vaccine is gonna come out, and crossing our fingers, we never get to the second wave. So about the schools, my idea, about the schooling for kids, it's a good chance that some of our kids would get it when they go back to school. But the reality of this is, our kids need physical activity. They need emotional support from their schoolmates and from their teachers. Psychologically, it's very much affecting them, and I can see that in my kids. So I think it's better if they go back to school, but they can also do some online schooling. So it could be both school and online schooling. So that way they can see their friends, have activity with their friends, and at the same time they can do some online schooling, so they're not always in a school. So again, my recommendations are: wear a mask no matter what. Wear a mask. It's very important to wear a mask. You can also wear gloves around your work, but wash your hands. Very important. Thank you very much for listening. Please give a like and ask for questions in the comment, and subscribe to my channel. I very much like to continue this channel. I enjoy it so much. It has changed a lot for me. And please do subscribe. Thank you very much. And again, thank you for tuning in into my channel, Ask a Pharmacist Corner. Have a good day.